Lorenz Tate, and I'm proud to support the Rare Disease Diversity Coalition as they address challenges faced by rare disease patients of color.
Hi, my name is Tate. In terms of rare diseases, it is important to know your family history so you have the knowledge to be aware and the power to protect your health. This is Tate, and I wanted to share something with you. If you're currently suffering from a rare disease, know 4 things. You're resilient, impassioned, strong, and empowered, and together, we rise for rare.
It is Rare Disease Day 2022, and the Rare Disease Diversity Coalition would like to welcome you to today's events. Up first, we have a powerful discussion featuring Lorenz Tate and his brothers Lamar and Laron, moderated by the co-host of Entertainment Tonight, the talented Michelle Turner. Let's get started with our program.
I'm a lucky girl. I really am. I mean, come on. Look, I'm here with the Tate brothers. I'm so excited to be here with you all today. It's an early birthday present for you, girl.
Yeah,
it really is. And listen, I love the conversation that we're going to have. We're going to have conversations about health, getting down to the nitty-gritty, talking about how we need to talk to each other about this. And kudos to, the Black Women's Health Imperative for always looking out for our health. And also today's conversation that's brought to you by the Rare Disease Diversity Coalition. They are also here to make sure that the information that our community needs, it gets.
Yeah.
Yes, thank you.
Absolutely.
And we're lucky to be here with you too.
Yeah.
We're celebrating your birthday.
We celebrate.
Yeah. Go Shay. Go Shay. Go Shay. Go Shay. Go Shay.
Hey. Well, I am with the Tate brothers today, if you see, Lorenz, Lamont, and Laron.
Yes.
And we're going to just have a little chat about health, and get right to the root. Because one of the things I love about working with the Black Women's Health Imperative, which thank you to them for having us be here today, and also for this conversation that's sponsored by Rare Disease Diversity Coalition. They really want to get to the root of us, folks of color, talking about health, finding out what's going on within ourselves and in our communities and in our families. Because I don't know about you all, but I know with myself, one of the things that I'm still trying to make up for lost time with is my family and I didn't really talk about our health. I didn't know things.
Right.
I have things going on with me now as an adult that my mother dealt with that I never knew, that maybe if I did know, you can kind of get ahead of some things. So this is why I really, really love these conversations. And I love that you all, number one, as Black men, and then Black men with a platform, are getting serious talking about health. So I want to jump in because the theme of today's conversation is knowledge is power. We know this.
Yeah.
Power. See what I did there?
Right.
See what I did?
Yes, I like what you did. Yeah.
Yes,
So
indeed.
I'm wondering, and I'll start with you, Lorenz, because you're closest to me. When did you decide, as a family, that you were going to take this approach, getting serious about health, talking about health?
Well, health has been a real big thing in our immediate family with our father and our mother, who always wanted to try to make sure that we had the best of the things that would keep us healthy. But as you know, typically in Black communities, a lot of times we don't want to go to the doctor. We don't want to talk. We don't want to really talk about some of the issues that are going on. But our parents are really, good about putting things on the table for us and to address that. And as adults, we look back on all the things that they instilled in us, and we try to apply that. And one of the things that we've seen over the years, just with our own family, not many rare diseases, but we certainly have seen things that are common in the Black community, right? You're talking about high blood pressure,
I knew you were going to say that first. Yes.
High cholesterol,
yes, diabetes, all of those things.
A lot of those things. And we said to ourselves, how do we sort of combat that? And I think, as you pointed out, the knowledge, right, which is very powerful. And the more knowledge that we have, and the more conversations that we feel good about having, and creating safe spaces to talk about health, because health is so important. And the older you get, the more you begin to look at how your life, how you want to lead your life, especially from a healthy standpoint. So, having a platform where we can now utilize that to talk about health issues, to talk about rare diseases, to kind of, sort of cast a light on these things and these issues, and sort of raise a voice for the voiceless.
First things first, and correct me if I'm wrong, Lamar, but as a black man too, I would think like if you're approaching your buddies or whatever, talking about, they're probably like, oh man, come on, I don't want to talk about that, man, come on, come on. So how do you have those conversations when you want to get serious? And is it simple as, look, man, I want you around, or look, man, like, you know what I'm saying? How do you have those conversations? Because I think a lot of people at home would be thinking too, like, maybe I do want to talk to my boys, maybe I do, but I don't know if they want to hear that. You know what I'm saying?
The one thing that I find is, being that I have 2 siblings, that they are my best friends. So it started from home, as Loren said, from a family standpoint. And then my friends and I, listen, we get to the nitty gritty.
Right.
We are a brotherhood, and we discuss all things, right? Not just sports. We talk about the healthiness and the wealthiness of ourselves. And at this time and day and age, it's a serious matter. As you get older, you find ailments in life, and you gotta figure, hey, okay, so I'm not moving like I used to move, or if something breaks, it's not healing just the same. So taking it from that, just the natural body parts, but then like you said, we're talking anything that may be of a rare disease, like you said, from high blood pressures to cholesterol, just the simplicities that are complex. And so my thing is, I get into conversations with my guys, and we talk about all things. Hey man, I'm sick, I'm not feeling well. Well, what are you taking? Well, let's get into what you could, prescribe yourself that's from a natural standpoint, as well as a medicine from the Western side.
You talked about that your parents opened it up early on for you all to talk about everything, which I think is fantastic. And LaRon, I'm wondering, because you guys, you do talk about so much. You talk about rare disease, specifically sickle cell anemia is a topic that you all tackle. Was it something that hit home with you all, or was it just something that this affects our community? The majority of these cases affect our community. So was it just like we want to give back in that way?
The truth of the matter is, it came from our mother.
Okay.
We were doing a lot of different celebrity events and supporting some of our friends and some of the initiatives that they were doing. And Lorenz, give him credit, he was like, I need to do something. And more importantly, it's like my mother was like, well, you guys should do your own. And we didn't know what we could come up with. And my mom told Lorenz, like, hey, how about sickle cell? Why? Because it did hit home, not in terms of us collectively, like none of us have sickle cell.
No.
But we have one cousin who has a trait, and his daughter has a trait. Outside of that, our mother, her friends were suffering from sickle cell.
Yeah, these were people who are like our surrogate aunts that we grew up watching and hearing about sickle cell and how it affected them. And we didn't quite understand it. And when our mother said, there's a lot of people who look like us who are dealing with this, and we know how painful that journey is for those who are suffering for that particular rare disease, that she felt it was really important for us to, raise our voices and once again give some light to these issues that oftentimes in our communities, when you're dealing with rare diseases or things like sickle cell, it doesn't affect the mainstream or what you would call the masses.
Right.
You don't get the same kind of support.
Absolutely.
You don't get the same kind of media attention. And it just made so much sense to us that we listen, that's great. And it's, the more we got involved with it, the more we began to talk to our surrogate aunts or friends or people who actually live with the disease, we felt like this is what we need to do.
Right. Yeah.
That was a really nice way of Loren saying, because it affects Black folks, there's not a lot of attention paid to it, not the most funding, doesn't to the most research,
whatsoever.
all of those things. Yeah. So I completely understand where you're coming from with that. And I think so many people have heard the name sickle cell anemia, right? But let's talk about really what it is, because there's probably so many people out there that may not really know what sickle cell is, right?
It's an inherited blood disorder where a so-called defected gene is passed down. For those who are carriers of that sickle cell trait, that gene, if a mother and a father have a child, there's a high probability that the child will have the actual disease. So it's a situation by where blood flow and oxygen is pretty much blocked in the body, right? And it doesn't get the proper flow going, and it causes chronic pains and these are what people who live with the disease call crises. So it's excruciating. People who have these crises, it can affect from the top of their head to the bottom of their feet, and they can be out and oftentimes hospitalized, and people go through those crises, and it's tough.
Really quick, just the simplicity of it. Our blood cells are like circles.
Yeah.
And it flows through your body, but when it's a sickle cell, it's crescent shaped.
Right.
Like a moon, like a course of
half a
moon.
moon. So what it does is it doesn't flow the same way that a normal blood cell. So it causes clots. And that's the form of crisis that the people have, because it's not flowing. Your blood isn't flowing the normal way.
So is this, let's play sickle cell for dummies real quick. So is it because it's a sick cell?
No,
is that where the name
The
comes
sickle
Sickle.
is a shape.
Right. Okay.
So it's like a moon.
Like
and so
the crescent.
Like a crescent. So because those particular blood cells are shaped that way, that's why they call them sickle. These are cells that are shaped different, and it's hard to flow, and they block the oxygen.
Talk about some of the campaigns that you all have done to raise awareness for sickle cell.
Yeah, well, we created the Tate Brothers Foundation years ago, and essentially, that was a way for us to sort of get this nonprofit and to, bring people around, whether they were other celebrity friends of ours, to say, hey, this is something that's really important to us and to our community. And, one of the things was really getting the awareness out there. And then what are some of the solutions, trying to, connect the communities with, health care providers or people who can help, in their situation. A lot of times families who are living with someone who has sickle cell, sometimes they don't know what to do sometimes.
Right.
And that awareness was really important. And for those who do or who know what to do, we wanted to sort of bring them in because, let us allow those who are actually experiencing this, who are actually on this journey, let them talk, because otherwise no one is, had been really listening. And there have been some advocates out there, but we really said this is how we want to do it. We created some really great fundraisers in Chicago, and eventually we were able to take it to Congress in Washington, D.C. and get some initiative.
Sickle Cell Act.
I love that.
Yeah.
I love that.
Get some initiatives.
Word and deed. I love it.
Get some money going on.
I love that so much. When we were kind of just chatting earlier, I was telling you that I have what's called thalassemia, which is, it's the same as sickle cell, but like usually you were saying, mostly Mediterranean folks get that. I'm still trying to figure out where it comes from. Actually, I just did 23andMe and found out I have Asian. I had no idea, not one idea, and found out that my father's mother was part Asian. Didn't know.
It's a combination of all of that.
It's wild. So it can affect so many more of us.
It is. If we would include the people with the trait itself, it would be an epidemic.
Yeah.
But because they only consider the people with full blown sickle cell or thalassemia, then it doesn't get the same attention. But it's a lot more people that has it or walk around dealing with it than we really know.
And another thing is, a lot of people may feel embarrassed or shamed, and so they stay silent. And this is a platform here as well today, as well as what my brothers and I do, is to let them feel comfortable and, as he said, have a voice, speak up, and be empowered in that.
Yeah, because sometimes, if you're living with a rare disease such as sickle cell or any rare disease, sometimes you may feel like you are on an island by yourself, or you may seem like you are weak, or people may look at you as a weaker person, but you're not at all. And oftentimes, I'm telling you, we've seen children live with this, and things that they've had to endure. Trust me, they're stronger than most of the healthy people. I promise you.
We've been to the hospitals, and that was another thing. We would go to the hospitals with our fundraisers, with our celebrity friends, and we would read books and spend time, and that couldn't come to our event itself. We would do it twofold. In our event, we would have the kids who could get out come and skate and bowl with us, and was a great
Just
thing.
trying to,
Yeah.
celebrate
What
them.
about your own family history? Are there things there that you're like, we need to watch out for? There may be a history, because the statistics are 72% of, rare diseases are genetic.
Yeah.
And so is there stuff that's come up that you all are like, okay, so we have to figure out a way? I remember Halle Berry years ago talking about how she has diabetes. And she's really tried to like combat it any way she could so she didn't have to start taking insulin.
Right.
Sure.
I started doing the same thing because there's a history of diabetes in my family. So I'm like, oh, you can do things before, you can try to fight, you know what I'm saying?
It's
Yeah.
preventative care. And for us, I think one of the things in our family is we stay very conscious of the cholesterol. Yeah. My daughter, one of my daughters has high cholesterol, and I try to manage mine as well. It's not as high off the charts, but she's young, and we're like, you got to be mindful what you're eating. Lay off the cheese.
No, but cholesterol also, from what I've gathered from people I've been working with, is kind of something that you kind of pass down, right?
Right.
That cholesterol, as much as I try to fight mine, I've had to change sort of a lifestyle in terms of diets and all that stuff. And that's also preventative.
Folks want to know, let me just say, folks want to know what Lorenz is doing. Because he's not aged. He has not aged.
Honestly,
Darius, I'm calling you Darius.
That's cool. Go ahead, call me Darius Shay. I call you Shay.
They call him brother to the night. Groove in your left eye, trying to be the funk in your right.
Hello.
So what are you doing? Because seriously, people are like, he's got to be doing something right.
Right.
Taking care of himself in some way.
Sure. Yeah, I take my health very seriously. I'm very conscious about what I eat. And exercise is a really big thing for me. I'm trying to just stay fit as much as I possibly can. So I, work out several days a week. Yeah, I work out 6-7 days a week. You know what I mean?
Please tell the sisters too. You don't care if our edges are a little rough. Get in the gym.
Get in the gym. Yeah. Listen, you ain't supposed. Listen, you ain't got to listen. Honestly, you ain't. When you go to the gym, you ain't supposed to be like made up anyway.
Thank you.
I just, what I'm saying.
It's not a fashion show.
Yeah, and it's cool.
It's a
Listen, but let me just say this.
Sweat the hair out.
I don't. But for
Sweat it
those,
out.
let me just say this: for those sisters that are coming to the gym, and they all dialed up, I'm cool with you if y'all dialed up, because at least you get to the gym.
Right, at least you're there.
If that's what's going to be your incentive to get up in the gym, you know what I'm saying, and catch up with the rest of the world, you know what I'm saying, in terms of being healthy is really important. Also, again, I think it's just a balance. I mean, for me, it's just mind, body, and soul. Meditation is a big thing for me.
Yes.
I try to stay as
Mental
much,
health.
in prayer and meditation and whatever, works for anybody, whether you have a higher being that you recognize or not, whatever that is. I think spiritual spiritual space is really important
But
too.
you're so right, Lamar. You just said, your mental health and your physical health go hand in hand.
They do.
It's called balance.
Absolutely.
You have to.
It really, really does.
Yeah. You have to find a way to tap into your inner being and be true to that. As they say, you can have a gut feeling, but you also have another conscious voice that speaks to you that you own, and it owns you, and you have to know how to have that communication. You're not crazy. Stay in the house if you need to do it, but get it done. Because honestly, you look in that mirror, you can only be true to self.
For sure.
That's it.
For sure.
The lies aren't for the people, it's to you. Simple as that.
We're preaching a word today.
Hello.
We were kind of talking about preventative measures.
Yes.
And so, Laron, I'm going to get this to you. Is there anything that someone can do to lower the risk of developing a rare disease? I mean, even if it's genetic or non-genetic, are there things that we can do?
Well, I mean, one of the first things you do, if you can find a way to the hospital, the doctor,
The screen.
You got it. Unfortunately, for black men, let's just talk about black men.
Absolutely.
We have a tendency not to visit the doctor. Now, granted, some of us can't afford health care.
Yeah.
Now, that's a bigger
That's
issue.
a systemic thing.
It is.
That's another conversation we can get into.
That's another full
I have
convo.
thoughts, lots of thoughts on that.
It's all connected. But if we can find a way to at least, like Lorenz said, get screened, and actually, one of the things that my kids' mother asked me, she was like, "Do you know your blood type?" And I was like, "See, there we go." I called my mother for my blood. I said,
I had to call
I'm calling my mother for blood. She said, "My blood, I don't know. I know Lamar's because his and mine are the same. It's rare." I said, "Okay, you know what? Next week I go to the doctor."
Right.
I need to know, and I'm having my blood drawn. I'm like, these are things that even me at this age is, just overlooking things and taking things for granted. Little things like that. I think one of the things we have to do is look at, when in terms of our health, like you said, the preventative care, part of that starts with what you put in your system.
Absolutely.
But also, what we talk about, going back to how our parents raised us, it also kind of what is instilled early on in your life, you know what I mean? How you sort of were raised. Our dad was always like, he's athletic, and he's always sort of, instilled us with health and athletic, all that good stuff. But oftentimes, man, as black men, just speaking about that, sometimes we just, we're dealing with so much of just getting through this that like, that's not really on our, because we gonna get through anyway.
Absolutely.
And that's true.
Absolutely.
We're gonna get through anyway,
we don't
but
have
on
to
top
prolong
of
it.
we can go further.
Yeah,
Exactly.
don't prolong it.
Exactly.
Another thing that, which goes to what Lorenz is saying, like right now at this age, I'm man, I go on my cabinet, it's vitamins from A to Z.
Absolutely. Same
Yeah.
here.
I'm like
Same here.
I popped in, I had at least take 15 vitamins a day. No
Jeez.
joke.
Right.
Because I'm like, I'm covered. Now, currently in our state,
yeah.
I've increased
You
the
have,
many. So
yeah.
echinacea is 3 times.
Yeah, but you know what? My thing is like this. We don't promote any particular kind of lifestyle for anybody. It really is not a one size fit all.
Right.
We have to be clear about
It's
that.
true.
So whatever works for him
Exactly.
may not work for me, may not work for you, may not work for Lamar. But the fact of the matter is that, trying to at least care a little bit more about what you're putting in your, because the food is your temple, right?
Yes.
Your temple is important.
Absolutely.
And the food that you put into your temple can either help you or it can hurt you, depending on how much you're putting into
Basically,
that temple.
you can't live off of Cheetos and
Hot Cheetos. I can't have hot
we wish
Cheetos
we
and
could.
Man, I listen
God.
for
Do you know how
breakfast. I'm
long
having hot
it's
Cheetos.
been? Oh.
I mean,
You know you want them hot
That
Cheetos.
Listen, I'm a chip dude. I love me some chips.
I love
Salt
Doritos.
and crunch girl.
Listen,
Come
I love
on.
chips.
I can miss me with the sweets, but the salt and the crunch.
Oh my
right,
God.
I love some chips. Oh my God. But yeah, but again, in that, I just try to find some balance. How
And
do
it's
I?
called moderation too.
Yeah.
That's one of the things that you have to be mindful of the consumption in terms of the intake and how much. But again, what goes back to your question at hand is, I think the first step is to actually visit a healthcare center, whether it's a clinic.
But let me tell you, sometimes people cannot visit healthcare centers and
Yeah,
all that. So you know what another thing is? There's another thing called internet.
I was about
Google.
to say it. I was about to say it.
The information is
Hit it.
It's true.
Listen.
But
Hit that button.
But you guys, I want to drill down on this a little bit too, because you were talking about, number one, go visit the doctor. And if you can get there, that is the ultimate.
Yeah.
But number two, I would also say when you get to the doctor, ask questions.
Questions?
Yes.
Ask lots of questions. I'm dealing with that. My assistant right now is dealing with some health things, and she, didn't have insurance before, now does, and can get to and she's telling me what the doctor, I'm like, hold on, did you ask? And she's like, well, I didn't know to ask.
Right.
Even
Right.
with, I just had a 3rd fibroid surgery not too long ago, and I've been dealing with it for a decade.
Wow.
And I know now, like if I knew 10 years ago what I know now, to ask questions, to get a second opinion,
Right.
to keep asking more questions, even if you're getting on their damn nerves,
Right.
keep asking.
Yeah.
But
And if you feel like, trust your body.
Yeah.
If
Yeah.
you feel like something's
But a lot of
not right,
people-
it's probably not right.
Unfortunately, a lot of people aren't as in tuned.
Yeah.
Right?
That's what I
They don't have
said.
the
You got to
ability.
know yourself. But
Yeah.
also, not just ask questions, but share what's going on with you.
Absolutely.
People go to the
And don't be
doctor with
afraid
this
to share,
fear.
especially with your doctor.
Yeah, and listen, I'm so transparent. They be
too.
like, man, why are you telling me that?
Me too.
I'm like,
the
"Because."
shape was this. And the I'm not even playing. What does that mean?
Right.
Well, again, it goes back to us in terms of what that comfort is and how often you've been exposed to it. And I think the key is at a young age.
Right.
If we're giving the kids that information and putting that effort towards making sure our children are healthy at an early age and instilling in them the importance
Yeah.
of health, because
Yeah.
one of
Right.
the things that I have is older friends that like to tell me, hey man, if I had somebody 5 years older than me telling me the things that I would be dealing with,
Right.
I'd be in a better place.
Right.
Again, it goes back to roundtabling.
Yeah, no, go for it. I'm sorry.
No, I was just going to say that. It's about roundtabling, having someone you can communicate with.
Yeah.
And sometimes it may not be your parents as much as you want it to be.
Could be friends.
And going back to up top when you asked, how do you do it, man? I tell my friends and we share. I was telling my brother some things the other day. Man, I was at the doctor the other day. This, and this.
Absolutely.
It's just what it is. I can feel comfortable. Again, it's finding a space of comfort.
Because 9 times out of 10, if you're saying it, someone that you know and love is probably thinking it or feeling it and not wanting to say.
Right. Yeah, because you have to create a safe space for people to feel comfortable to have these conversations. No one wants to feel like they're being judged, or you're passing judgment on them. If you have an opinion, you're thinking you might have some concerns, because sometimes it can be very sensitive because it's so personal to people that either their appearance or something that they're dealing with may very much so be something that they're not comfortable talking about.
And on the other side of it, because we often talk about the folks that are battling diseases, but the caregivers for those people, what kind of advice would you give to people that are maybe on the other side of it and have to be the support system and have to be the caregivers and have to, deal with that side of it?
Well, first, I just want to say for those who are amazing caregivers, we thank you. For real, because there are some amazing people that are out there. Unfortunately, it's just not enough, and we need more, people who can, give people the knowledge and the information. And what we're talking about, sometimes we just, even now, like, I have more access to things that people in my family may not have, because I'm gonna keep it real, for who we are and who I am. I have different kinds of access, right? And so with me, I try to share that information as much as I possibly can. And I'm like, yo, this is really out here, and you can get that kind of health care. It's really, it's amazing.
Oh, I get on people's nerves. I get on my family's nerves. Oh, they see me coming and they're like, oh, here she coming. Talking about eating salad, talking about getting up and walking, but it works. And now it's starting to sink in.
It'll resonate at
some point. You need to do.
You want, and people being the best version of themselves. And I think that's what it is. We sort of get like that. And now it's crazy because we used to come back, we're originally from Chicago. We've been in LA for a long time, right? But we've traveled all over. And we've met so many amazing people and have so many incredible experiences. And so when we go back home to the crib and we talk to the family, and we have a big family. My mother comes from 13, Pop comes from 8. We got a lot of family. Long story short, we used to come back and we should talk about all the new things. But it seemed like to them, we was on some Hollywood, on some other stuff.
Of course.
But here's the crazy thing. Everybody's calling us now like, hey,
how you do this? Thing you doing? How you prepare that meal you was doing the other day?
Exactly.
What's that? Yes.
Exactly. How do you do this plan? What's that low calorie thing? What's that low glycemic thing you were talking about?
Someone has to jumpstart the engine, so that motor runs.
And listen, when they call, and I'll sit on the phone with aunts, cousins, uncles, whoever. I'll sit on for hours. And I'm serious.
Literally.
I'm serious. I'll sit on because I enjoy having a conversation. As you can see, we like to just talk about it.
It's a different conversation now, because now they're sharing their experiences with us. And they're telling us all the things, like, you familiar with this? This is the new so-and-so, and you got to get this. And I'm like, wow.
They dropping knowledge on us.
They are.
Literally.
Exactly.
I love that.
Oh, listen, my mother will call me now and say, guess what I had tonight? I had baked chicken and a salad, Michelle, and I did 45 minutes at the gym. I'm like, well, go ahead.
I love that.
But that's a beautiful motivation.
And it's like, because it's great. And then you start to feel like, okay, this is something else shared that we can have and that we can do. I do want to get back to the rare disease conversation for a second, because I thought the stuff we were talking about was really important. And once again, thank you so much to the Rare Disease Diversity Coalition for sponsoring this conversation today, because these talks like these are needed.
Absolutely.
Folks need to get in your living room, get on the couch, get in the chair, and just have this same type of conversation, right?
Absolutely.
But so I want to go back to that and talk about, when you are diagnosed with a rare disease, and I'll just use sickle cell for an example because it's one that we've kind of used specifically here today. I've heard so many people, it's a fearful time because it feels like almost like a death sentence when you get it. So going into it, what are, what are some words of advice for new diagnoses, for people who are just starting this journey? Some things maybe they can watch out for, they can know, you know what I'm saying, or what to expect when they're battling this.
You know, my thing is, again, just to let those who are diagnosed with rare diseases know that they're not alone.
Yeah.
You know, this is something that, even though their specific disease is rare, but, you know, they have people out there that can help them through it. They're not weak because of it in anything, that they can keep their confidence up and feel empowered as much as they possibly can. I think a lot of times when people are diagnosed with these rare diseases, the psychological aspect really weighs heavy on them. And so, you know, we just want to encourage those out there just to continue to keep your spirits up. And it's not the end of the road. You can continue to move forward, and you continue to fight. Whatever you do, don't give up.
And you can live with this.
You can. And another thing I want to share on the opposite side of that is share with those so that they can assist you, as you were speaking on caregivers and things of that nature. And again, speak so that you can learn together to see what you could do as you're diagnosed. LaRon, you know, when we would go to these hospitals and the education we would get from them, I know that one of the things that one of these young ladies, and I remember very clearly, she shared about the blood transfusion.
Lyric. So
yes.
what happens is that, you know, most of I want to speak to young kids, you know, that's dealing with this, whether they're diagnosed or if they've been living with it for a while and they're fully aware and they have these blood transfusions, because, you know, it's mandatory that they get blood transfusions. One of the things that the family should know is that be mindful of the iron overload, which happens when you know, have that transfusion, because if you get too much iron in your system, it starts to shut down body organs, and it can lead to, you know, liver problems,
real problems.
A lot of more physical problems than what they had with just having sickle cell and going through the transfusion. But much to what Lorenz is saying, you gotta fight. Don't feel, you know, embarrassed by it, because, you know, just treat it as a situation where now you know that you have to, when you become an adult, or if you are an adult, you got to be mindful to not get someone or procreate with someone who has the trait or the actual sickle cell.
And I got to say that the experiences that we've seen or we've been a part of just meeting these people and just hearing their stories and just watching them, you know, is really inspiring in a real way, because when I think that things are going tough for me, I always can reflect on those who are dealing with rare diseases. They have some real issues that, you know, most people couldn't handle and deal with. And so I'm really inspired by that.
Well, you know, blessings to you guys for saying that we are, you know, not just going to sit back in our celebrity. We're going to use our voices, use our platform, speak up, be loud about it. You know what I'm saying? And continue to be loud about it, because I think that's what is so desperately needed, especially for our communities in, you know, across the board, and especially in terms of rare disease. Before we go, I'm just wondering if there's anything you all want to share in terms of health, just, you know, advice for people, just, you know, anything. Because again, I think hearing from black men to black men, I think it's so important to hear these things. I mean, as women, we talk about, we're the feely people. Let's talk, let's share what's happening. But so many times I think black men, like you said, are you know, you have so much on your shoulders, so much that you're just trying to fight through and get through the day unscathed. So the last thing you want to do is sit down and talk about how you're feeling. You know what I'm saying? So just any last words.
Yeah, I just think that it's important to do so. We can talk about all the other stuff that we do and talk about as men. Health is something that is certainly important, and you know, you don't have to feel like you're being weird or you're feeling like you're being a downer because you're having that conversation. I think it's okay for us as black men to look out for each other. Because it says something about us, that we care about each other, and it's okay to care about each other and show love for each other.
Amen.
Yeah,
Okay.
it really is.
Lamar?
I say get a doctor friend.
Listen, that might be the word of the day.
Get a doctor
Get
friend.
yourself a doctor friend.
Yes.
Yes,
And if you
indeed.
we have one.
We have several.
You see what I'm saying? I need to get one.
What is your pain threshold? From 1 to 10, what is it?
on,
so
man.
smart. That's so smart.
Listen, my 2 cents would be, at the end of the day, share with the people that you love.
Of course.
And if you're by yourself, because everybody don't have a network of family and friends. If you're by yourself, you're not alone.
No.
There are groups that you can join, and advocacy groups
I love that, yeah.
will, assist and help out. You don't have to go through it alone. No one should.
And don't ignore. If you got something going on, and
man.
something your body, as you said, listen
Yeah,
to your body,
listen to your
listen
body.
to your temple. Don't keep putting it off. And if you are around somebody who's putting it off, find a
same.
way to nudge them and encourage
Motivate
them,
them,
to
yes.
get the help and the information that they
Absolutely.
Yeah.
need.
Oh, this hit me on so many levels today. It really did. And happy 47th birthday to me. This is
Happy
great.
birthday,
young lady.
Get out of here. I thought you were gonna say happy 27th
Come on,
birthday.
now
Okay.
47, baby. I woke up. I earned every one of those years. I appreciate y'all. I really, really
As
do.
we do,
And
yeah.
I'm just honored to be here with you today. And I loved hearing this conversation. I loved sitting down, chopping it up with you all. And somebody's gonna watch this,
Yeah.
and they're gonna say, "Damn, yeah."
Yeah.
You know
It's
what I'm
time.
saying? Yeah,
Good.
it's
Yeah.
time. I gotta quit playing around. So
Yeah.
thank you
Thank you
guys.
so
Thank
much.
you.
Thank you
We
so much.
appreciate you.
Peace and blessings, Queen.
And Nichelle, happy birthday to you. 25 years old is what I say, and you did a great job despite being so seasoned at 25. It's great to be here. My name is Richard Louie. I'm an anchor over at MSNBC and NBC News. And, Nichelle, it's always great to watch you during your day job. It's even great to see you lean in on a topic like this, the Tate brothers, for being so honest and bringing all of yourself to this very important topic. It is rare to talk about rare diseases, and especially in the communities we're talking about. But today it's not so rare, which is making it very, very amazing that we get to gather here. We get to now move into our second panel. And, as we understand the family history, as we understand the solutions that you may approach, as the Tate brothers did so well about being honest about the topic, we're now going to talk about how do you advocate into that space. Before we get into that conversation, though, very quickly, I want to thank our co-hosts for today, the Rare Disease Diversity Coalition, the Multicultural Media and Correspondence Association, as well as the Black Women's Health Imperative, 3 groups coming here today to talk about, as I said, something that's so important. And of course, there are those that make it possible. There is Alexion, AstraZeneca Rare Disease, Bluebird Bio Horizon, Travere Therapeutics, Vertex, and Arunia. All right, I was telling you about our next group of speakers today, and we've brought in a really amazing, different types of voices, if you will, sitting in the same seat or in the same room together. And today we have Olga Lucia Torres, lecturer and health advocate at Columbia University. Olga, good day. Dr. Yves Duriceau, chair of the Department of Emergency Medicine at Lenox Hill Hospital. Good day to you, sir. Sashay Walker, Chef Sashay Walker, caregiver for a son with FSGS. Thank you all for being here as we move into our second panel on how to advocate for your health as a BIPOC patient. Now, who better to start with than Chef Sashay? And tell us what it has been like for you as a mother caregiving and advocating for a son with FSGS.
First of all, thank you all for having me. It has been quite an interesting journey. Aiden is now 13 years old. He was diagnosed with FSGS at 8 years old, and we were very unaware of what FSGS was. He was initially given a different diagnosis, so it took about 6 weeks in the hospital and a kidney biopsy to determine the correct diagnosis. And we initially believed that we would manage it with medication. Unfortunately, his kidneys failed very quickly, and he was on dialysis within 5 months. So he was diagnosed in January. In February, he was given the correct diagnosis, and then by June, he was on dialysis 4 days a week.
One question, Chef Sachet, I wanted to ask you, what is the best way, as you went through that journey when you were working with your son, what was the best way for him to say, I have a rare disease? And how did you talk about how to show him how to express that idea?
Well, from the very beginning, I got involved with NephCure. I met Kelly Helm from NephCure through Facebook. And from there, she introduced me to other patient parents and children who were battling FSGS and other forms of rare kidney disease. And from them, I learned kind of how to speak the language and how to explain it to kids and adults and to school administrators and things like that. And now at 13, Aiden has his own routine. Him and his brother have their own way of explaining it to kids, when he can't get in the pool because he has a port or things like that. Aiden likes to tell people that he's Iron Man. So he has a port in his chest. Yeah, he has a port in his chest that he uses for dialysis, and they have a whole routine of how they explain it to their friends that have never been around it before. So him interacting with other kids that are going through the same thing he's going through has given him a lot of confidence.
So he says, I'm Iron Man. What does he say next?
Well, he says, that's also why I'm short, because his brother's friends are younger than him. So even though they do sports and he doesn't, he's older than them. He's the only teenager in the group. So he loves to say, you might be a little bigger than me, but I'm older than you. And my growth is stunted because I have kidney disease. And then he gets his respect that way. I don't know. I think it's a boy thing.
He got it done. He gets it done, rather.
Absolutely.
Hey, Olga. Yeah, no, I could go on and really learning about what's your son's name again?
His name is Aiden.
Aiden, I just want to talk to Aiden about this whole process because, trying to describe what you're living through is so difficult. And Olga, as you help others explain, not only in the doctor's office, but for families, what is the best way to say, I have a rare disease?
So, thanks for that question. I think it's really important for patients to learn how to advocate for themselves, right? I too have a rare disease, scleroderma, and I quickly had to learn that it's really crucial that two really important things. So we learn how to ask many, many questions, right? Because when you get diagnosed, as the Tate brothers said, and I think Sachet would agree with me, it's very overwhelming, right? So it's key that we don't be embarrassed to stop and say, hey, these are my questions, and get them answered, right, to your satisfaction, right? And the other thing is that you have to learn how to advocate for yourself, right? That you become a very well-informed patient. So what does that look like? Well, I agree 100% with Sachet that you find organizations that can be a resource for you. First thing is, don't go down the Google machine because, it's too much information and most of it isn't 100% reliable. I learned that when I was originally diagnosed with lupus. I'm a bit of an overachiever. I have 6 autoimmune diseases because why have one when you can have, as many as possible, right? So what I found with the Lupus Foundation of America was that they had reliable information. My doctor sent me to them. Then I found that they had support groups, and I found a community. In fact, I'm an ambassador for them. I volunteer. And I think Sachet would agree that you find a community that supports you. And if you have a child, that can support them as well, right? And so when I was diagnosed with scleroderma, the doctor sent me to the Scleroderma Research Foundation, right? And they just were chock full of information that I found reliable. But then I realized that I had to, the doctors show up as professionals and us as patients need to do the same, right? We need to take our health seriously, just like the Tate brothers were saying. I just love that interview, by the way. And in order to do that, I came up with an acronym that I thought, like, when you're in the office and you're getting information, right? And Dr. DeRusso is gonna, I'm sure, agree with me. There's just like a lot of information coming, and all of that information you organize in your head like goes out, right? So the acronym I came up with is HEAL, HEAL, right? I thought that was clever at the time. So the H stands.
It's still clever. Still clever.
The H stands for honor, right? As patients, we should honor our time and the doctor's time and show up prepared. So that could be like, let's say you had blood work done or you had like a x-ray done. You can log into your patient portal. I love the patient portal, and see what those results were and front load those questions. So you can come in and say, hey, Dr. DeRusso, what does this mean, right? Another way to do that is I like to create a document that I call a medical resume. We all have professional resumes. We should have a medical resume. So you can do that on a Google Doc. You can put it on your smartphone. It's something very basic, like your name, date of birth, what you were diagnosed with, when you were diagnosed, medicines you take, things you're allergic to. I like to include medicines I've been prescribed that didn't work, right? I'm going to forget the names of those medicines. So if I'm sent to another specialist, why waste time by repeating medicines, right? Then you have the, and I have that document on my website. It's completely free. You can download it, and I don't send emails to anybody. The E stands for expertise. You should be an expert in your body, right? Do you know your blood type, Richard, like the Tate brothers were saying?
No.
Yeah, okay. So that, those are things.
You didn't tell me you were going to do this to me, Olga. Come on now.
So you should, those are things like, my daughter has sickle cell trait, right? These are things that we should all know, right? And also when the doctor says, when did your symptoms start? You shouldn't sit there and go, I don't know. Like these are things that we should be able, those conversations that we should be able to have with our doctors. Okay, so the A is assemble, right? We should assemble a healthcare team. Doctors have a huge healthcare team. They have other healthcare providers. They have the medical billing system. They have a vast database that they can log in and see. What do we have, right? So we should get a healthcare team of people that are going to be able to help us make decisions about treatment, questions we could ask. And they should be people level-headed, right? They shouldn't be like your mom if they're going to be crying when you say, I need to start chemo or something, right? So assemble your healthcare team. And the last one is listen. You should really listen to your doctor and make sure you understand what they're saying. And this is crucial because we have such a high health illiteracy rate in the United States, right? Only 12% of adults understand what the doctor is saying to you, or even those pamphlets that they give you, right? We just don't understand it. So who's amongst those of us that are health illiterate? We're talking college graduates, teachers, and engineers. So that's why it's so crucial that we take our health seriously and that we find a healthcare professional to partner with us in this journey, especially if you have a rare disease.
Yeah, and Olga, what you're saying is, and I'm glad you did ask me about what my blood type is, I should know that, right? I should be carrying this around with me. I should be thinking about that, whether I have a rare disease or not. And it's about taking ownership and responsibility, at least to some level. And I think your idea of a resume is a fantastic idea. We have resumes for everything else in our life, just about. We've got cards for everything. To get 5% off at Walmart or whatever the case may be. We got all these other things. So why not do that? I think that's a really great idea.
And Richard, what I found also, like if I'm not feeling well and it's on my Google Doc, my husband has it. He can pull it up. If I'm not feeling, he could say, this
great
is for
idea.
medicines. Right?
A shareable document, right?
And or a friend, right? So I partnered with a friend who has cancer. And when I go with her to visits and she's not feeling well, she takes the notes in there, right? These are her symptoms. This is what she's feeling like. It's a great way to help friends that are going through a health issue at the time.
And the key is that it is your narrative. It is what you are saying you are and what you are living through. Dr. DeRusso, I mean, this is very interesting from your perspective as you're dealing with all of us folks walking in. And you're training all of your doctors in the emergency room to identify rare disease. Please react to what the chef said, as Olga said. But I'm also interested in, from your perspective, doctor, what is the best way to say I have a rare disease?
Thank you for that question. And I want to start by acknowledging everything that was mentioned by Chef and Olga seems very simple, but we have to understand and come from the standpoint of empathy. These are very, very challenging conditions to have. And so what we do, actually what I do is we actually teach physicians how to have a relationship-centered communication with their patients. And there's 3 pillars to that. And a lot of it has to do with what Chef mentioned and Olga mentioned. The first is we have to build a relationship with the patient. What you've heard through this panel and the panel before is there's often a reluctance to speak and to express yourself. Well, part of the onus is on me as a provider to give the patient that space to be able to express themselves, to build a relationship, to understand what's going on at home, the dynamics, the impact that these conditions have on the patient. What was the commute like to even get to the office? What sacrifices did you have to make? So those are the kind of things as a physician we have to be open to. The second pillar is to assess and understand. Often the patient comes in with a fear. And if we don't give the patient the time, the space, and I tell my doctors, you have to sit down and shut up. Sit down and shut up and just listen and ask open-ended questions. Don't ask closed-ended questions because you want to run out the door. Back to what Olga was saying, show that respect, give the patient the time to express themselves, ask open-ended questions. And the third part, if you get the first 2, you build a relationship, you really understand what the patient's concerned about, you're expressing your empathy verbally, you'll come to a great collaboration. And that's ultimately what you want. You want that patient, like in any other thing, you listen and follow the recommendations of people you trust. Well, if you don't trust that doctor, you won't follow their recommendations. And a very small, easy thing to do, I teach my doctors to do, in terms of, we mentioned health literacy, is I do something called teach back, and I teach the doctors to go do teach back. And it's simply this: Richard, we just discussed a lot of things during this visit. What are you going to tell your wife when you get home that we discussed? Because when you get home, that's the first thing she's going to have. Well, what did the doctor say? And I need to give the patient the space to reiterate and make sure that they're processing and understanding what I just recommended. And I've also learned through that process that sometimes I, as a provider, forgot to tell them something. So it works in both directions. So these are very small, simple, powerful tools that we try to teach our providers, because they didn't learn this in med school.
Yeah, and that last one, I can go. Olga, are you talking? Go for it.
No, I just think that's so critical, because just a study done 10 years ago showed that when a patient came in and said, Richard, why are you here to see me? And you started telling the doctor would cut off the patient on average between 15 and 18 seconds, right? And just 3 years ago, that same study showed that doctors on average cut off patients between 11 and 13 seconds. Once you're cut off, then that whole white coat syndrome kicks in, which is very real, right? And then there's that imbalance of the doctor's more important, their time is very important, and what I came to say is not important. But then, like Dr. DeRusso said, the minute that happens, the trust has stopped, right? You don't respect my time, and then you're telling me to take this medicine, go have that test. But what's my imperative in doing that if we're not building a relationship here, right? But the same studies show that if the doctor let me speak, I would have stopped speaking between 45 and 48 seconds. It's just another 30 seconds. You showed me respect. I've told my story of why I came to see you. And now we're on an even playing field, right? Because you've listened to me, you're respecting me. So like Eve said, it just takes time. Just give me the time to tell my story. And now I feel heard. And now I'm trusting you, right? So I think that's so important. And I think what he's doing in his program is just wonderful, because it's so needed. And it's not being done enough, right? And it's the key to us being able to, especially in the rare disease space, where patients are often not trusted, not believed. It'll make such a huge difference.
How many seconds do we want for 2022, Olga? How many seconds do we want?
We want to give the patients the time to really tell their stories, because they're not being believed. Ease will tell you, especially in the sickle cell space, where they're thought to be, there's so much racial bias happening in this space, right? And I think that's a key thing for us to talk about, but I'm going to let you drive the ship.
Well, that's a good segue. Chef, as a person of color, and as we understand it, we're already in the rare disease space, right? Rare. And then you bring in the fact that you're a person, a family of color, and you're addressing an issue that brings two things together. As we saw in COVID, all of the things within our society all of a sudden come together, and we have to understand what it is telling us at that moment. We're going in to deal with medical issues, but often other things around us also coincide and collide with that experience. What was your experience, Chef, as you and your son, as a family of color, were addressing FSGS?
Well, if I can just piggyback off of what the doctor and Olga were saying, it's so important for your doctor to understand who you are. When Aiden was first diagnosed and we went into the hospital in January of 2017, we were not discharged until September of 2017. So around March, after we got this diagnosis and we knew we weren't going home, we had to make several lifestyle changes. His father and I were co-parenting. And so I quit my job, gave up my apartment, and I moved into the hospital with Aiden full time. And we rotated everything in shifts. I moved in with a couple of friends and was couch surfing and just working as little as possible because he needed all of my attention. And as co-parents, we discussed that. And once his doctors understood that, like, oh, you're living in the hospital right now, you've given up everything to make sure that your child has the best health care, then they were able to, meetings at rounds in the morning started to get a little longer. We were able to get more comfortable with each other. I was connected with a social worker that helped pay for parking because I didn't have a job anymore. So piggybacking off of what the doctors were saying, it's very important for your medical team to know you. Once Aiden's dietitian knew that I was a certified private chef and I went to culinary school, then we were able to work together to figure out recipes and dinner options and things that were more kidly friendly. It wasn't just stop eating McDonald's, stop eating canned food, stop eating salty food, because a lot of times when you meet with medical professionals, they don't know you and they go based off of statistics and information that they already have based on other people. And so I had to explain and make it clear, well, we don't eat a lot of takeout. We don't eat canned food. I feed him he's a pretty spoiled chef kid, so he eats really well. And so once we were able to get on the same page, then I was able to work with the dietitian and work with NephCure. And we recently just completed our first low sodium cookbook together. And so all of those things and opportunities came about by just getting to know each other. Our medical team at Lurie Children's in Chicago, we were living in Chicago at the time, was incredibly instrumental in making sure that Aiden understood everything that was happening to him. I really appreciated that they spoke to him like an adult. They didn't really baby him at all. And Aiden is intelligent and he wants to know what's going on with him. So I'll ask questions and he'll ask questions and things like that. So we were able to create a trusting environment. And if you're a patient, parent, or a caregiver, you have to build a circle of trust with your medical team in order to facilitate the best care for your child.
What's the name of that cookbook?
The cookbook is called, I think it's called NephCure's or Chef Sachet's Low Sodium Cookbook. It's not out yet, but it will be out soon. We're finishing all the final graphic design stuff, all the fun stuff. So as soon as it's out, it will be made available free to everyone who is battling kidney disease. And I'll make sure that you get the first copy.
I hope so, as well as the URL to get to it. Chef, that is fantastic, taking a situation and being proactive about. Doctor, please react to what Chef said. But in addition to that, when you look at all of the patients that come through your doors there at Lenox in the emergency department, give us a piece of advice, a way of understanding that there are certain differences based on our background. And, you know, we're here with RDDC, and so this makes a lot of sense that we try to understand that layer. And I know Olga can follow on after that.
Yes, thank you for that question. And, you know, we've just unpacked a lot of what we said before about that relationship with the patient and how important it is. But to answer your question, and using sickle cell as an example, you know, that the voice of the patient. So unfortunately, this rare diseases impact disproportionately minority communities. And that you know, interaction with the healthcare providers sometimes is not ideal. So I'll give you an example. Two patients, and patients all want the same. They want efficient care, they want great care, they want it to be efficient, and they want that empathy, they want that compassion, right? No matter who you are, what the setting is. So we have two individuals that come in, let's call one a 50-year-old white male CEO of a company X, okay? And then let's have an 18-year-old sickle cell male patient from Harlem. They both come into my ED, and they both want, again, efficient care. And maybe there's a timeliness issue. So what does the 50-year-old CEO do? Well, he calls my CEO. And before you know it, I'm getting paged, everybody's getting paged. And then 8 people descend in his room, they fluff his pillows. True story, okay? What does the 18-year-old African-American male from Harlem do in terms of advocating for himself? Well, he doesn't have those channels. As the Tate brothers mentioned, that Dr. Fran doesn't have those connections. So how does he verbalize his frustration? He's been in pain for 3 days. He tried to manage his pain at home, which most sickle cell patients do, because the last thing they want to do is come into an emergency department, and his voice is not being heard. So he or she may just start screaming, may start cursing. And how does the healthcare providers react sometimes? Maybe they call security. True story. And where does that relationship go? It's soured. Where does the care of the patient go? It's soured. So we as healthcare providers, we need to understand the stories that the chef just mentioned, that Olga mentions, what they go through to get to us, all the sacrifices that they have to make for themselves or their loved ones. And we need to have that empathy and compassion and really understand that. So that's what we're teaching. And the message is getting across. And if there's a silver lining with COVID, I think it's really shown the healthcare disparities, and there's more of an understanding of implicit bias, of healthcare disparities. And so we're going in a very great direction. Even this panel, this conversation today, what the Tate brothers are doing, it's amazing. And so the future is bright in terms of, you know, relationships with our patients and the communication. So we hope to continue on this journey.
You know, doctor, is that too much for your doctors? It almost seems, I mean, I say that in that already you spend a lot of years trying to figure out just, okay, this looks like an A, this looks like a B, this looks like a C, except there are 6,000 rare diseases, 6,000 of those. And then there are also the ones that are not termed rare diseases. I say this in a way that we all have to understand there's, what you're saying, a relationship. We're talking about potentially two humans talking to each other, and now we're going to get to solutions. But at one point, you have to wonder, as I've been in emergency rooms a lot over the last 6 years, there's been through so much. I mean, how can they have enough filters to understand everything? I'm not trying to give excuses, just trying to understand how do you help them to get better at what you just suggested, because it does seem like this is just getting to be more and more challenging. COVID was a good example. It became so extreme.
Exactly. So I think, look, there's education, and part of what I do is I educate around sickle cell and rare diseases. As clinicians, new technologies, new inventions, we need to be continually updated, and we do that. So that's the first part. The second part is leveraging technology. And we're not quite where we need to be in terms of universal health records. Olga has done a tremendous job, I'm sure the chef, in keeping their own personal healthcare records and to be able to share that with the provider. That goes a long ways. And for patients with sickle cell, especially because there's so much bias around the pain management and use of opioids, it's good when they come in with a care plan. It's a sort of a contract that they have with their doctor that's established, that they could show that objectively goes through, these are the recommended treatment modalities that I need specifically for me. And so, but then where does that care package remain? Often it's a paper. Even in 2022, we need to get it to the point where it's electronic, it's universally accessible, so that the burden is not on, as Olga mentioned, or Chef mentioned, on them to have to provide that for providers. So as healthcare leaders, we're also on the journey to have tech to help empower us to help the patients.
Great stuff. And Olga, as we look at this dynamic of who we are in so many different ways, and again, for the moment, let's talk about being people of color and walking into, and Dr. Durso brought up that example that was based on real incidents. How do you talk about that? What are some of the pieces of advice you would give?
Sure. So, this semester I'm actually teaching social justice narratives of inequity at Columbia University in the narrative medicine program. And most of my students are healthcare providers. And we look at real studies where, for example, patients with sickle cell come in, and even the narratives that are put in their health record, right? So if you have a doctor, like Eves would put, patient comes in and is in pain, right? And needs let's say is asking for opioid, versus saying patient is reporting, claims to be in pain, claims that the pain is higher than so the language even that is put in the medical record, that also dictates what other doctors that are going to see him later and what they think about the patient, how they're going to treat the patient in the future. Like all of that, even what's happening in the moment, and then what gets put in the record, as Eve says, right? So we need to realize this, both racial and ethnic bias, obviously it exists in healthcare providers, but because it's implicit, it's really hard for them to recognize it and see it. But it leads to misdiagnoses, it leads to delayed diagnosis, and sometimes it can lead to deaths, right? So it's really important to address those issues. And it also, there's the issue of the fact that when we're looking at these rare diseases, they're often very delayed in being studied for medicines, right? And then when they are studied, we have the issue that in the clinical trials, it's really hard to get Black people, Indigenous people, people of color in the clinical trials because of these implicit biases, right? The doctors don't think to ask the patients, or the trials are far away from where the patients live. There's issues of transportation, or if the patients are poor, they work in wage jobs, right? So their schedule isn't flexible to say, hey, I need to take off because I want to be part of this trial because I might need this medicine, right? So there's a lot of barriers to getting us even into the clinical trials, but we need to do way better for that. We need to just do a better job of that. So all of these things are things that need to be addressed.
Yeah. And one of the things I was thinking of, going back to my health resume, right? My narrative, Olga, is do I become, let's say I'm Native Hawaiian. Do I then look up what are the typical trends for being Native Hawaiian, being a person of diversity, and saying, well, in my father's community who's Native Hawaiian, obesity trends higher. I need to let you know that, doctor. You may not know that, but just letting you know. And because of that, A, B, C. Do we just self-declare and become mini experts of the community we come from to put that on our health resume?
I don't think you need to put it, but I think there are things that you could say, hey, can we check for X, Y, Z? Or I'm concerned about X, Y, Z, right? Because lupus was my first autoimmune disease, right? It's not a rare disease, but it was hard to be diagnosed by it, right? I literally had every single symptom until I was finally diagnosed with it. So once I had it, I had to be on the lookout for other things, right? It is like a gateway autoimmune disease for other things, right? So I had to be the one that was, hey, I have this other symptom, that I could be this other autoimmune disease, because you do have to be, the onus is on you, right? Because it's your body, right? So the onus is on you. So I would jot it down on my medical resume. And when I went in, that's what I would remember to ask those questions of the doctor. Yeah. For sure.
I actually did do that for my father, who is Asian American Pacific Islander. And I would say my dad may look skinny, but in this community, people look skinny but have high blood pressure, have heart disease. They look skinny, but don't think because they got all those other things. But it's typical in this community that they look like that, but they may not be okay. So I started to do that because every time I'd hear, oh, but all of this, his weight, his BMI, and all this, I said, no, hang on a second. He's had heart issues in the past. You got to know this about these Asian American folks. They look this way, but they could be the other way around. Okay, I actually say that.
It's so
Richard,
important. Yeah.
I call that skinny fat. Being skinny
fat. There you go.
I didn't even know that was possible. That happened to my mother and I. And I was like, wait a minute, because I used to be heavy. I was like, so what did I lose weight for if I'm going to have the same issue?
Absolutely. A doctor or chef, were you going to say something?
Yeah, I think that's a great point. There is a lot of stigma that comes with being a person of color seeking medical attention. When we first put Aiden in therapy, around 2017, just to help him cope with having to be on dialysis, I didn't know anyone who had a child on dialysis. And so I put him in therapy, and his first therapist diagnosed him with this really, I was just going through his medical records in his chart, because I'm that mom that downloads every test result. I have all of Aiden's medical records on my phone, and it's like thousands of pages. But when I meet people and I need an explanation on something, I'm able to pull things up quickly. Well, he was given this diagnosis of like aggressive depression and anxiety, and he had only seen her one time. And I said, well, why was this diagnosis put in his chart? And he's only seen a therapist one time. He hasn't been prescribed any medication. He hasn't been prescribed any type of anything. So why is it? Well, we know that, he might get frustrated or want to open up about stuff. So we put that in there for insurance purposes. And me and his father had them take that off of his medical records, because he's never exhibited violent behavior. He's never exhibited aggression towards anybody in any position of authority. And I did not want my Black son labeled because he's a Black son, So then we found him another therapist, and she was fabulous. And Aiden is still in therapy. I've since gone to therapy, and it's just nice to have someone to talk to. But I felt like I had to fight that stigma early on, because he was given a diagnosis after one session that I just, as a mom, I wasn't comfortable with. And so once we got that off his medical record, which I didn't even know that I could do until I got angry and started asking questions. But once I found out that I could do that, he doesn't have an anxiety disorder or a depression or some type of depression disorder. He's just a kid trying to navigate life with a chronic illness. And 5 years in, he is better for it.
How did you talk to Aiden about that, Chef? Did you say, hey, Aiden, they put this in your, does he know that they put that in his medical record? Does he know that you said, hang on a second, this is not correct? You had one meeting for whatever number of minutes, and you're saying this all of a sudden. Did you tell him that? And how did you? That's the first question. Part of the question. Second part of the question is, how did you reach out to the doctors to say, hold on, please change this?
So first, I did talk to Aiden, because after his session, I understand it's hard for children to talk to their parents, and so I knew that. Knowing my child, I know that he didn't want to tell me everything because he didn't want to worry me even more. And I just explained to him, hey, are you feeling anxious? Are you feeling really down and depressed? And I Googled the definition of depression, and Googled some clinical terms, and I asked him, are you having these feelings? He was like, no. He's like, I'm not depressed or anxious. I'm just really, really annoyed that I'm always in the hospital. And that's exactly how he explained it to me. And I said, well, does it help talking to someone? And he said, yes, but I also want to meet kids that are in my situation. So we connected with some kidney mom groups, and that helped him as well. Repeat the second part of your question again.
Oh, the second part, you told me about the second part. The first part, you talked to him. The second part I wanted to know is, how did you approach the doctor to say, or the medical staff to say, hey, would you consider taking this off the record? How did you go about that with them?
So I initially was not comfortable going directly to the therapist about it. So I went to Aiden's nephrologist. And shockingly enough, I spoke with her and I said, hey, I'm really uncomfortable with the way this was worded in his medical record, because he doesn't
What's
have—
a nephrologist, just really quickly, by the way?
Kidney specialist.
Thank you.
So if you are a caregiver for someone with kidney disease, the nephrologist and the dietitians are your best friends. And so because we had built a relationship, because they knew I was living in the hospital with him, and his father and I were rotating shifts, she said, I will talk to the doctor for you. And if they cannot provide any evidence of any violent, erratic behavior, this will be removed from his medical record as soon as possible. And that's exactly what happened. I didn't have to be the one to do it. I was able to trust my medical team to stand up for me when I felt like I couldn't stand up for myself.
Really great stuff, Chef. Thank you for that. And talking about having a best doctor friend, we may not have a nephrologist. I don't know, maybe Dr. Durso, you are a nephrologist, but you're our best doctor friend in this conversation. What do you think of what Chef Sachet had done there?
Well, look, first my heart goes to just hearing that as a healthcare provider. It really hurts to that she went through that, and that her son had to go through that. But again, I think that the chef and Olga are exceptional, off the chart, uber patient advocates. But the majority of our patients, unfortunately, don't come in so prepared, so informed, so empowered. And as healthcare providers, we need to know that they're coming from a place of vulnerability, and to meet them where they are. And so that is the burden that we have to meet as healthcare providers. Chef mentioned the medical records that she has. Well, in the healthcare field, we here at Lennox, we're developing a program called Playback. And Playback allows you to kind of do what I spoke about, the Teach Back. It memorializes the conversation that you have with the provider. It provides you with the labs at the point of discharge, and any pertinent imaging, so that when you go to the next healthcare provider, you could share that, or you could share it with your loved one when you're sick. So those are the things that we need to help our patients with, to empower them, to give them that voice that's often missing.
Yeah, and that is so helpful. I know with my family, my father, again, as he was battling Alzheimer's in the final stages, being able to share the medical records and logging in to be an official caregiver of that loved one made it so much easier for us to communicate as children with each other, saying, just go to that medical record, sign up as go to his medical identity, log in as a caregiver, so that we get these blood test results, which were happening so often. You get it directly, so that the four of us as advocates could talk and have all the information real time. That is so helpful and has been so helpful. Olga, I know you want to get in on this.
No, yeah, so 2 points. I want to circle back to when you're a caregiver. My daughter was less than a year ago diagnosed with a very, very rare form of juvenile arthritis. And I thought it was, I don't know if it's just the doctors trying to be very thorough. There were a lot of questions around, like, are you sad? Do you want to hurt yourself around this diagnosis? And I had to pump the doctor's brakes, because I was like, why are you putting these ideas in her head? And my daughter was like, no, I just want more information. She's just a very inquisitive kid, loves science, right? So she was asking a lot of questions around that. And I had to go into the patient portal and like look to see what was put in the chart, right? So I think just my heart goes out to you, because I was chef, because I too was like, what are you putting in our chart? And we're going to take that out if you put anything suspicious, right? But secondly, yeah, I think the patient portal is a godsend. What I found problematic is doctors don't tell you, hey, you got a patient portal, go in, activate it, your information is there. So if you go to a new hospital, you are given often that piece of paper on your way out, but you're not given instructions. So for me, it took a long time. They would give me this thing. I didn't know what it was, super informed, right, person. And I would just throw it in the garbage until finally I took the time and I asked somebody, why do I keep getting this? And they were like, that's your access code to your patient portal. I was like, this is gold. Why didn't someone ever really explain this to me? So I think that's a key thing that I think healthcare providers need to be more proactive about. But yes, you need to like really take ownership of that, check what's in there. They had put that I was depressed. And I'm like, again, I had to go in and I had to say, take that out of my chart, because like it follows you from one hospital to another. So you need to really be the one that is like looking over that carefully, seeing what's in there, and being able make sure that when you go to another hospital, give them permission so they could see the charts from other hospitals that you're seeing. I think it's such a key to have it, and also to have the apps on your phone, because most of the hospitals, you can download the app, you can put it right on your smartphone.
And if I can just piggyback off of something really quickly, if Aiden was expressing, symptoms of depression or anxiety, I am more than willing to get him all the help that he needs for that. We are not denying the presence of depression in caring for chronically ill patients. But my concern was, as a Black child, I did not want him labeled when it was time for us to move to a different medical team, because they had the way they had worded his depressive episodes, they had worded him as kind of exhibiting violent behavior, and not because he had ever exhibited a violent behavior, because they assumed that he will eventually exhibit violent behavior due to an inability to communicate his feelings. And I did not want him labeled as that going into different situations if that's not what he was actually exhibiting. But I am in no way denying the importance of providing mental care for long-term illness patients or anything like that.
Yeah, those red flags will follow you everywhere. I went through that myself with another issue. Those messages that can be years old are still going to pop up when for some reason, for whatever reason, and the reasons you described there, Chef. All right, we're hitting the last, if you can believe it, our last 10 minutes. And, last round of questions, and this is what can be done if you had a magic wand and you could do one thing to help increase the awareness of advocacy when it comes to rare disease and BIPOC communities. What would you do? What would you have either community, government, business, what would you have them do? And I'll start with just Dr. Duraceau here. Is there anything legislatively that you would go for, since you're as an administrator of an emergency department here? If I gave you that one wish, what would you do legislatively, for instance, to support the efforts that we're discussing today?
I think this is a great question, and it actually harps back to a time in roughly 1972. You can imagine who the president was at that time. Under that government, there was a bill passed, the Sickle Cell Act, that was passed. And it funded roughly about $10 million for sickle cell, I think over a decade's period. And it really, what it started to do is to bring awareness around sickle cell, allow for screening. And then we got laws passed that every child now that's born has to be, in America, is screened for sickle cell in their blood type. So that's done. That's a major change. It made a major impact. We could increase the funding in terms of research. And then that allows money and grants in the community. And the Black Panther Party at that time actually had what we call free clinics, a free men's clinic, I think it was called. And they were able to go around the 10 cities where sickle cell had the greatest impact and do raise awareness, do the screening for sickle cell, have those conversations with the community to empower them of how to, when they go to the hospital, how to communicate with healthcare providers. So we need more of that. Fast forward now, I think Senator Booker and a colleague from the South also helped to pass some legislation around sickle cell, but we need more of that. We are so underfunded in terms of research in sickle cell space. If you look at cystic fibrosis, which overwhelmingly impacts white people versus people of color for sickle cell, it's 10 times more funded. And so we need to change that. And so to your question, that's where I would put a lot more efforts in terms of research, policy, and then, getting this to the community where it's needed.
Great stuff. And Olga, if you got the same wish that Dr. Jourso gave from the genie out of the bottle, what would you do either in community and in government? What would you do?
So I agree. Look, if you have a disease that a lot of people have it, then there's more eyes on it. You could do more advocacy, right? Through Lupus Foundation of America, we have days where we go to Congress and we advocate, right? Either virtually now because of COVID, but back in the day, we actually physically went, knocked on doors, we spoke to representatives, right? And we continue to do that. That leads to funding for research. But if you have a rare disease, there's less people to do that. So it should be even across the board where we bring awareness to these diseases. It's just because my disease has less than around 100,000 people, we're going to have less research for scleroderma, right? So that should be evened out. We need to do more training around the ethnic and racial bias, right? Because it's implicit, people aren't aware of it. We need to, the idea of cultural competency isn't real. We should have cultural humility because it's a constant moving target where doctors are able to say, I don't know this, I'm not aware, or just fall on the sword when they make a mistake. That's so hard because doctors always want to be right. So it's okay. We need to teach them that they need to learn how to learn about how to give and take with patients, right? How to be able to have those communications and be humble about them. And I think we need to learn how to build those bridges and so that doctors are willing to learn the narratives with their patients, which is crucial in rare diseases, right? I mean, I have a list of 1 million, but I know we're short on time.
Well, it's one wish. But I guess you can kind of omnibus that wish and put all those in if you like, because those are all important, all 1 million. Chef, over to you. The third wish out of the bottle here. This is it. What would you do to help fix things based on the dynamics that you've described to us today?
Absolutely. So as a chef, I work with Chef Art Smith's foundation, Common Threads, based out of Chicago, to provide free cooking classes after school for low-income communities. And so even with the world still kind of being virtual, I'm still able to do that. So what I would like to do for kidney patients and kidney families, because this affects such a large part of the African-American community, I would love to provide free cooking classes for parents and caregivers who need help understanding how to provide a kidney-friendly diet for their children or for their loved ones. I would also like to pair that with providing free, farmers market vouchers, free grocery vouchers, so that these families can afford to shop and eat healthy. The cost of groceries is incredible right now, and it is very hard to find things at the grocery store that are low sodium, low potassium, low phosphorus, which is the holy trinity of a kidney-friendly diet. So if I could provide a free program where I teach classes and I work with parents while also providing free groceries for them to take home and then execute this lifestyle plan, that is my dream.
Don't you, Doctor and Olga, don't you want to be part of her dream? I want to hop on that bus with you, Chef.
Absolutely. I'll send you a proposal.
All right, that and the new book, and the new recipe book on top of that.
Yes.
We'll finish with this. For all the advocates out there, give them the one sentence of encouragement they need to hear. For all the advocates out there, when we are talking about rare diseases in the BIPOC community, what's the one sentence you would give to encourage them? Olga, I'll start with you as we finish. One sentence, though.
Sure. You know, you have to be with community, right? When you get tired, when you get overwhelmed, remember that you're a part of a community. So be energized. Tap into all the resources that are out there, and keep doing it because of the patients that need our help.
That's a big, long, juicy sentence. A doctor, to you, one sentence in terms of that encouragement.
I would say that we are here, the empathy is here, but come prepared, come empowered, know your numbers.
Fantastic. And Chef, one sentence to other advocates to encourage them to keep on going.
I would tell them, you cannot change your diagnosis, but you can change your diet.
What a great conversation. I got to thank all three of you for bringing your all. And I know that there was so much more that you wanted to share. So forgive me for not getting to it all, but I think you've just offered to a lot of folks in this space some practical ideas as well as some inspiration that you can get it done and that it should be done. So thank you. Thank you, Chef. Thank you, Olga. Thank you, Doctor. Thank you, all three. Thanks to the Rare Disease Diversity Coalition, the Multicultural Media and Correspondence Association, and the Black Women's Health Initiative, Health Imperative rather, who gathered us today to talk about this important topic of how to advocate for your health as a BIPOC patient. These virtual conversations in support of Rare Disease Day. Thank you all who joined us today. Stick around with the RDDC. More in the future. You know where to find them on the internet. And for now, have a good day.